Hello and welcome to Workers' Comp Unwrapped, the podcast that simplifies workers' compensation for physicians. So, let's get started. Welcome to Season 3, Episode 4 of Workers' Comp Unwrapped, with Max, your host, and our guest Ayesha, who has 15 years of experience in the industry. If you're a provider navigating California's workers' comp system, you know that the calendar flipping to January 1st isn't just about New Year's resolutions. It's often a seismic shift in how you get paid. And for 2025, we're bracing for some truly significant updates to both the physician and pharmaceutical fee schedules. Our mission today here on the Deep Dive is to cut through the noise and unpack exactly what's new for 2025, what codes are shifting, the precise ways you need to bill correctly, and crucially, how to make absolutely sure you don't leave hard-earned money sitting on the table. Think of this as your essential pre-flight checklist for navigating the New Year's billing landscape, helping you avoid those notoriously common and often expensive headaches.
That's right. And to truly understand the what of these changes, it's vital to briefly touch on the why. California's workers' comp fee schedules, both for physician services and pharmacy, aren't just plucked out of thin air. They're intrinsically linked to Medicare updates, which means they reflect national trends in medical costs and other critical cost benchmarks. The DWC, or Division of Workers' Compensation, conducts an annual review precisely to align reimbursements with current costs. It's less about bureaucratic whims and more about adjusting to the evolving economic landscape of healthcare.
So it's not some arbitrary punishment, but a necessary annual recalibration. And that, of course, means every single year brings new codes, deleted codes that simply vanish from existence, and adjusted payment amounts, all of which, frankly, can easily trip up even the most diligent billing teams if you're not paying extremely close attention. It's like an annual system reset button for your entire practice management and billing operations. The moment you blink, you could be behind.
And 2025 is certainly no different. For physician services, for example, you can expect a fresh conversion factor, a new multiplier that impacts your reimbursement rates. And for pharmacy claims, we're looking at entirely new drug pricing benchmarks. It truly is a comprehensive refresh across the board, affecting almost every claim you'll submit.
Okay, let's unpack this for physician fees first, because that's often where providers encounter the most intricate adjustments. For 2025, the DWC has updated the physician fee schedule to reflect Medicare's RVU, or Relative Value Unit, adjustments, and a slew of new CPT codes. What's particularly striking are the specific changes we're seeing. For instance, there are brand new EM codes, specifically for telehealth and prolonged services. This is a critical area for modern practice, especially after the last few years where telehealth just, exploded.
Absolutely. And the updated conversion factor, which is projected to see a slight increase, perhaps around 1-2%. It might sound trivial.
Yeah, 1-2% doesn't sound like much.
Right. But if we connect this to the bigger picture, think about a practice processing hundreds of claims a week. Even a small bump like that, compounded over an entire year, could translate to an additional, say, $10,000 to $20,000 in revenue that was previously being left on the table. It's incremental, but it really compounds significantly. What's also fascinating here, and a notorious source of confusion and frustration for providers, is the issue of deleted CPT codes. These aren't just gone. They're often replaced with bundled codes for certain procedures. It's a genuine trap for many providers.
Bundled codes.
Yes. We recently saw a case where a physical therapy clinic continued to bill separately for a group of manual therapy procedures that had just been bundled under a new code. The denials piled up for weeks before they realized, costing them not only the initial reimbursement, but also significant administrative time to rebill. It's a classic case of, if you're billing the old way, you're losing money.
Right. It's not just a matter of don't use the old code. It's now build this entirely new combined way. That's tricky. And then there's the nuanced clarification on modifier usage, especially for workers' comp-specific scenarios like med-legal evaluations or certain surgical assists. Those tiny nuances in a modifier, a misplaced digit or an incorrect suffix, it can lead to major denials. It's like a secret handshake that has to be just right.
Precisely. For providers, my expert advice is immediate. You must update your coding manuals and rigorously double-check those modifiers. Now,
Don't wait.
don't wait! I've personally seen denials spike dramatically in areas like prolonged service codes or even specific diagnostic imaging, when these modifier requirements aren't addressed properly.
Yeah.
It's really low-hanging fruit for denials if you're not on top of it from day one.
That's a huge one. Such a small detail, but a massive financial impact. Okay, let's shift gears. Talk about navigating the pharmacy fee schedule shifts for 2025. What's the foundation here, and what does it mean for our listeners who might be dispensing medications or managing prescriptions?
Okay, so the drug fee schedule is undergoing a significant update. It's moving to incorporate the latest medical pharmacy pricing data and updated NDC, or National Drug Code, listings. What's fascinating here is that if you're dispensing medications in-house or maybe tracking prescriptions for loaning cases, you will absolutely see updated reimbursement amounts. And it's crucial to understand the distinction, especially between generic versus brand name drugs, as their pricing benchmarks will be significantly affected by these new medical links.
So for pharmacists and providers who dispense, what are the crucial updates they absolutely need to be aware of, to avoid losing money on every pill?
Okay, first, revised AWP, or average wholesale price benchmarks. This is absolutely fundamental for accurate drug pricing. If your system is still pulling old AWP data, you're essentially underbilling before you even submit the claim. It's automatic lost revenue.
Ouch. Okay, what else?
Second, there's stricter coding for compounded medications. This is a significant area where the smallest details really matter to avoid rejections. For instance, compound claims often require specific ingredient NDCs and precise calculations for dispensing fees. A common pitfall is just listing the final compounded product rather than breaking down the components as required by the new rules. That leads to immediate denial and, frankly, a mountain of follow-up work.
Wow, that sounds like a nightmare.
It can be. And finally, there are clarified rules for dispensing fees and unit of use packaging. You need to ensure you have the precise billing methodology down to a T. No guesswork.
This brings us to a really crucial point, which is the proactive playbook. How to prevent denials with accurate coding. Here's where it gets really interesting, because I want to challenge a common assumption. Denials spike in Q1 not because carriers are suddenly more aggressive or playing hardball. I mean, let's be honest, they're always playing hardball.
Right, that's the baseline.
But the real controversy here, I think, is that it's often because providers and their billing teams simply don't adjust their codes fast enough.
Yeah.
It's about unpreparedness, not necessarily malice from the carriers.
You've absolutely hit the nail on the head. It's about readiness, not malice. From my 15 years in this industry, I've seen countless practices caught off guard. I recall one particularly painful instance where a specialty clinic swore their EHR system was fully updated for the new year. They were adamant.
Okay.
3 months later, they discovered they'd lost tens of thousands of dollars because a single critical modifier for a new telehealth code wasn't adjusted in their billing templates. It wasn't that the carrier was malicious, it was a blind spot in their own process that became a very, very expensive lesson.
Wow. A single modifier.
Exactly. So here are the concrete steps providers can take to stay ahead, turning those potential pitfalls into preparedness. First, you absolutely must update your CPP and NDC code lists immediately. Like right now if you haven't already. That means reviewing all new, deleted, and revised CPT codes for physician services. For pharmacy, diligently cross-check your current NDCs against the updated medical listings. This isn't optional, it's foundational. If you're still carrying those old codes like bad baggage, you're setting yourself up for failure.
So no more lingering old codes in the system. Got it. It's a total digital cleanse. Purge the old stuff.
Exactly. A digital cleanse, I like that. Second, scrutinize modifiers carefully. Those new prolonged service codes and telehealth updates often demand very specific modifiers that can be easily overlooked in the rush. A missing or incorrect modifier is an instant denial, a costly, avoidable mistake that comes up year after year. It's almost predictable.
That's a huge one. It's such a small detail with such a massive impact, turning a perfectly legitimate claim into a pile of paperwork and lost revenue. It's frustrating just thinking about it.
It truly is. Third, invest in billing team training. Seriously. A quick 15-minute refresher on coding changes before January 1st can save you months of appeals later. The crucial insight here is, don't wait until Q1 denials pile up, becoming a reactive nightmare. Proactive training is your secret weapon, preventing the bleeding before it even starts.
That's a brilliant move. Get ahead of the curve. Don't just react to the chaos when it hits.
And finally, link to authorizations unfailingly. Always attach RFAs, requests for authorization to your billing, especially when utilizing new codes. This removes any excuse for adjusters to reject claims. It streamlines your entire revenue cycle. It's about closing off those easy avenues for denial, leaving no room for doubt or dispute on that front.
Okay, this is where we talk about avoiding the gotchas. What are the top errors you observe every single year when fee schedules shift? A what not to do guide, if you will, because sometimes knowing what not to do is just as important as knowing what to do, right?
Oh, definitely. Well, the first one, which we mentioned but it bears repeating, is still pervasive, using deleted codes. Old codes unfortunately linger in EHR systems like unwelcome ghosts. They must be cleaned out now to prevent automatic rejections. It's a recurring nightmare for practices, leading to endless, frustrating resubmissions.
And it sounds so simple, but it's a huge drain.
Yeah.
Like trying to drive with the parking brake on. Just slows everything down.
It is. Another silent drain on revenue is incorrect drug pricing. Billing based on outdated AWP rates will lead to automatic reductions by the payer. We've seen clinics lose hundreds, even thousands, a month just because their pharmacy software wasn't updated to the new benchmarks. You could be losing money for months without even realizing it until you do a really deep dive into your EORs.
That's scary. Okay, third mistake.
Ignoring bundled codes. We talked about this, but it's a big one. Some of the 2025 changes combine procedures that you might have billed separately before. If you continue to bill these separately, as you did last year, you will see denials. It's not optional, it's the new rule.
So you're essentially getting penalized for billing the old way, even if the work is still being done and done correctly. Right. It's a classic workers' comp paradox. Yeah. Maddening.
Precisely. And finally, failure to reconcile EOR's explanations of review. This is absolutely critical, especially in Q1. Carriers often apply new rates much faster than providers update their internal systems or check the payments.
That makes sense. They have teams dedicated to this.
Right. So if you're not checking every EOR in Q1, comparing the payment to what you expected under the new 2025 fee schedule, you could be losing money for a month without even realizing it. This raises an important question. How do you catch that, and how soon can you actually catch it?
That's a perfect segue into our next point, the post-change audit. This is your crucial early warning system. Why is auditing so important, especially in January when everyone is usually just trying to catch their breath after the holidays? It feels like one more thing to do.
Well, what's fascinating here is that January isn't just about updating codes. It's about auditing your very first wave of bills to catch errors early. You can't just set it and forget it, hoping the updates worked perfectly. The system is always in motion, and you need to be your own financial detective.
Okay, so be proactive. And what's a practical strategy for our listeners to do this? What should they be looking for specifically?
My advice is pretty straightforward. Set aside dedicated time mid-January, maybe just a couple of hours, to rigorously review a batch of EORs for accuracy. Compare those payments line by line against the new 2025 fee schedule amounts. Flag any discrepancies immediately. Any payment that doesn't match what you calculated needs investigation.
Immediately. Don't let them pile up.
Exactly. The aha moment here is that it's infinitely easier to fix these issues now, within a few weeks of the change, than months later when they might escalate into full-blown litigation or force you to write off significant revenue you actually earned. Early detection is everything. It's the difference between a quick fix and a financial headache that drags on for half the year or longer.
So what does this all mean? Why is provider education not just important, but absolutely critical when it comes to these fee schedule updates? I mean, let's face it, it can feel like such a dry technical topic.
Right, but this raises an important question. Why do so many providers get caught off guard every single year? It happens over and over. Fee schedule updates are one of those silent killers in workers' comp revenue. No one really discusses them proactively until reimbursements visibly tank. And by then, it's often too late and the damage is done. You're playing catch-up.
And here's the cold, hard reality check for everyone listening. Adjusters operate under the assumption that providers are completely up to date on this information. That's their starting point. If your team isn't aligned and informed, if they're still using last year's cheat sheet, you will face unnecessary denials and severely delayed collections. It's an uphill battle from the start, and you're starting way behind the curve if you're not prepared on January 1st.
So my final piece of advice is this. Investing just a little time now in understanding these coding updates, conducting thorough staff training, and performing those critical early audits is a small upfront cost. But it will save you endless headaches and significant financial losses later in the year. Think of it as preventive medicine for your practice's financial health. It's not just about compliance, it's about ensuring your cash flow stays as healthy as your patients.
Okay, that's a great way to put it. Quick recap for 2025. New CBT codes, Adjusted physician conversion factors and updated drug pricing benchmarks are not just coming, they're here. The action items are clear.
Right.
Update your systems, train your teams, and audit early and often. Don't sleep on this.
And if we connect this to the bigger picture, accurate coding isn't just about avoiding rejections. It's fundamentally about maximizing your reimbursements. It's about maintaining smooth cash flow in a workers' comp system that is, let's face it, already complex enough. You're not just avoiding denials, you're actively ensuring your practice thrives and that your essential services are truly valued and paid for correctly.
That's it for this deep dive. Really important stuff. Check the episode notes for links to the updated fee schedules and coding resources that were mentioned. It's all there to help you stay ahead.
Absolutely. And next week, we're diving into a listener question that keeps popping up, and it's a thorny one. Why do silent PPO deductions keep showing up even after I terminate a contract? Spoiler. It's complicated, involving network agreements, leasing arrangements. We're going to unravel every last thread of that mystery. Should be interesting.
Looking forward to it. Thanks for listening. Thanks for listening to Workers' Comp Unwrapped. If you found value in today's episode, subscribe and share with fellow doctors. Stay informed and keep making a difference in your patients' care.